Can you just confirm you can scroll up and down? Perfect. Let's put 5 minutes on the clock for your reading time, and your reading time starts now. Your reading time is over. Your case time begins.
Hi, Sarah. I'm Dr. Damir.
Hi, Demir.
What can I do for you today?
I think I might be pregnant.
Oh, all right. Okay. Wow. How do you feel?
Sick.
Right. Right. Look, it's can be quite an overwhelming situation to find yourself in. Hey. Tell me in general, how are you feeling about finding yourself pregnant? What's on your mind?
I don't know. I mean, I only just found out myself and I just don't know what to do.
Okay. Well, have you been pregnant before?
No, it's the first time.
Okay. And have you told anyone yet?
No, I just made the appointment here.
When did you find out?
2 days ago. I didn't know if it was right, so I did a couple of them, but they're all saying positive.
Yeah. Okay. All right. How do you feel about the pregnancy? Do you have any thoughts of what you want to do?
Honestly, don't know. I mean, I didn't expect this to happen, and don't know if I'm ready to be a mum. Do I feel strange about not keeping it?
Okay. You haven't told the father, I take it?
No.
No. Okay. Do you know who it is though?
Yeah, but like it was a one night stand kind of thing, so yeah.
Okay. All right. So look, Sarah, I'll tell you straight away that everything we discuss here is confidential. Okay. It's all between us, and I'll talk you through sort of what our options are going forward, what sort of things we need to do, and then we'll make a plan for the next few weeks. Okay.
Thank you.
All right. So you're a retail manager, is that right?
Yeah, I've been doing it for like 2 years now almost.
Okay. And you don't smoke, but you drink occasionally, is that right?
Yeah, like if I go out and stuff, have a couple of drinks.
Okay. Do you know much about drinking in pregnancy?
I know you're not supposed to.
Yeah, just something I should mention to you straight away, since you're not telling me that you want to go for any kind of termination. At least at this point, I do have to tell you about a few things to keep the pregnancy healthy, and one of them is to let you know no amount of drinking is safe. Do you do any? Do you use any recreational drugs at all?
No, nothing like that.
Okay, all right. And in terms of your diet, would you say you have fruits, vegetables, meat, dairy, all in your diet?
Yeah, I eat pretty much everything.
Okay. Are you taking any vitamins or supplements at the moment?
No, should I be?
Yeah, so to keep a pregnancy healthy, it's important to take a pregnancy supplement. It's something called Elevate. If you just go to the chemist and take one a day, very good thing to do. Okay.
Right.
Any medical trouble with you up to this point?
No, I'm normally pretty fit and healthy.
Mental health wise, any trouble?
Normally good. Bit stressed now.
Understand. Yeah. Listen, the reason I asked the next question is because many women find themselves in an uncomfortable situation, and it's something that can be hard to talk about. But any violence, abuse?
No, nothing like that.
No.
No.
No. you're pretty happy that you're safe, nobody's coercing you into doing anything.
No. I don't know how I'm supposed to tell the father, though.
Look, it's your choice in the end. Okay, it's your body. It can be helpful to have that discussion together. I understand that the two of you are not a couple, right? That one's kind of in your hands. Well, we might get back to that, but there are ways to let them know and sort of involve them, in a positive way.
Yeah.
Probably your parents would be, I don't know what your relationship was like, but I think you might find them quite supportive in dealing with this
Yeah,
situation.
they're usually pretty good with stuff. I think this might freak them out a little bit, but...
I assure you it's nothing. Most adults have gone through this before. It can be quite helpful. Okay. Have you ever had a sexually transmitted disease?
I haven't usually had too much sex, to be honest. No.
Okay, fair enough. So when was your last menstrual period?
I think like 5 or 6 weeks ago.
Yeah, okay. And since then, any discharge, bleeding, spotting?
No. I think my boobs are a bit sore, though.
Okay, that can happen. Are you getting any nausea?
Like little bits just first thing in the morning. It's not too bad, though. Normally by the time I kind of get up and start doing stuff, it's okay again.
Right, okay. Any pain in your tummy or down there?
No.
Okay. As part of the sort of first things to do when you become pregnant, there's some blood tests, some scans that we run. One of the things we do is a sexually transmitted disease check. And what that involves is a blood test and a swab down there, okay? If you may have something without knowing it. So if you have something like chlamydia or syphilis, it's something that can affect the baby or the pregnancy.
I think I've got anything. I don't have any symptoms.
No, it's unlikely, but it's a part of our due diligence to check. Okay, all right. So that's something we'll do at the end as well. I'll give you some forms and send you to get those tests done. Any dizziness, lightheadedness? Okay. So part of the workup here is to send you for a scan. Okay. So we'll do a blood test that confirms that you're pregnant, but we'll need to do a scan to make sure the pregnancy is in the right place. So in the uterus, rarely pregnancy can happen not in the uterus where it's supposed to, but in the tubes that connect the uterus to the ovaries that make the eggs. If you've got a pregnancy in the wrong place, A, that pregnancy cannot go to term, and B, that pregnancy can make you very ill or can make you die when it bursts or ruptures. It's called an ectopic pregnancy.
I've heard of that.
Yeah, so we have to make sure that you've got a pregnancy in the uterus. If you don't, we'll need to, that pregnancy will need to be terminated. Okay.
Right.
So that's just part of our regular, is that we send you for a scan. Now that scan is done through the vagina, okay, just to let you know. Not through the belly, but through the vagina. Are you on any hormonal contraceptive at the moment?
I was on the pill a couple of years back, but I wasn't really very active then, so I guess I just kind of stopped taking it.
Okay, understood. We'll need to check, part of the blood test is to check your immunizations. I would check them online right now for you, but unfortunately I'm not able to.
Yeah, they're all up to date.
Okay, all right. I do need to let you know not to work with potting mix. to make sure you wash all your fruits and vegetables so you don't get certain diseases that can harm not you, but your pregnancy if you contract them. Scan. Look, I think as far as making sure the pregnancy is healthy and tracking it, we've talked about all the things I wanted to talk to you about. I personally don't have much to do with pregnancies. As a doctor, I usually send people to one of my excellent colleagues, GP obstetricians, and that's what we'll do. I'll book you in with one of them to discuss the results and again rediscuss where you want to go with the pregnancy. Did you want me to talk you through about options for termination?
I guess just so I know what the options are, I guess.
Yeah, okay. So as far as termination, there's two different ways to do it. There's medical and there's surgical. Okay. For medical termination, it's a tablet, again, unfortunately not something that I prescribe myself, but it's something you can take up to 9 weeks of pregnancy. Okay. It's a tablet that you take, and within the next 2 weeks, that tablet terminates the pregnancy, and you pass the products of conception out of the uterus, out of your vagina. Okay. There are risks of pain, bleeding, infection with that one, risk of incomplete termination or the tablet failing to work, in which case we'll need to proceed to surgical termination. If you go with the tablet, you'll need to have a blood test, follow up in 4 weeks, and see one of our doctors in 4 weeks after you take the tablet to make sure that the pregnancy is terminated.
Yeah. What's the surgical one then?
So the surgical one is where, a bit self-explanatory, the surgeon would put you to sleep. They would use instruments to get inside the uterus and terminate the pregnancy. Make sure all the products of conception are out. That way you know for sure that it's done. But there may be costs associated with that for having the procedure or for travel, and you'll have to take a few days off work. Okay. I would strongly encourage you to bring a support person with you next time.
Yeah, good idea. I'll bring my mum.
Whichever,
always there.
Yeah, mum's a great idea.
Whichever
way you go.
What about if I don't want to get an abortion, but I'm not ready to be a mum?
Yes, of course. The third option is adoption, so you can carry a pregnancy to term, and then you can the baby is then taken care of by an adoption agency. Pass it on to a family who are not able to but want to have kids. Okay, thank you for reminding me of that one. Do you have any other questions?
So you said I'll have a follow up with whenever people in your clinic. When should I be seeing them? Or how soon can I kind of find all this out?
No problem. I'll talk you through that. Just give me a second. One other thing to mention is try not to take the ibuprofen for your headaches in the meantime. Try to stick with paracetamol instead.
Yeah.
Ibuprofen rarely, but can be a bit harmful to a pregnancy.
Okay.
So going forward, what we'll do is I'll give you forms. That's a form for your scan. This is a form for your blood tests. This is a form for the swab. And I'll show you how to do that swab. There'll be a handout that'll talk you through it, or the pathology people will talk you through it. What we'll do is we'll follow up. We'll book you an appointment with one of our GP obstetricians in a week's time. By that time, the results will be available, and you can talk through your options with them and bring your mum with you. I do need to let you know about a few safety things. So, if something happens with the pregnancy, let's say it's an ectopic pregnancy, there's a few things you need to look out for. If you're getting a sudden onset of pain in your tummy, bleeding, fever, dizziness, okay, make sure you go to the emergency department or get an ambulance.
Yeah.
if an ectopic pregnancy ruptures, it can be required.
Okay.
You'll need to act quickly.
And that is time. Well done. So, how do you feel you went? I think you did pretty good. I think you're looking like you don't feel like you're as comfortable with that one as I've seen you with other cases. You said that personally you don't deal much with pregnancies. Sounds like you've got other GP obs in the practice that do most of that for you. Yep.
5. Yes.
5. Wow. Lucky. And that's fine as well. I think you actually did quite well in the case still. So really, this one is about the communication styles and giving those all the options on the table, and you very much accomplished that. Having a management plan in terms of actually, first of all, confirming, is she actually pregnant? And that's kind of usually step one. And you did that. You had that appropriate follow-up plan in there to say, okay, well, let's find out, one, are you pregnant? We'll do the blood test, we'll do the scan, and then we'll bring you back and we'll talk through from there. Next part of it then is saying, well, okay, here's what all your options are. And I think you did quite well of, you can keep the baby, you can terminate the baby, you can foster the baby. A little bit of prompting, that's okay. And that is one of those things as well that often for those ones like that people do forget, there can be a prompt in the script for the sim patient to actually kind of ask that question as well. And while we're not giving you the answer, it's, hey, do you even have this response on your radar? And you did. That's fine. I think something you did fantastic on was actually explore, what are your support networks and mentioning, I think next time you come in, bring your support person, because this is going to be an emotional roller coaster. And that's actually one of the big boxes that needed to be checked for this case as well. And I also thought you did a really good job of navigating kind of, one night stand. How do you actually tell the partner about that as well? And I really liked, I can't remember the exact wording you used, but it was, look, let's just kind of navigate this first step first and we can come back to that bit later. I actually thought that was a really nice, really gentle approach to it, that for a patient that's come in obviously kind of anxious and worried, I think you did really, really well there. The red flags you were getting through at the end, but just ran out of time. But the big one is, ectopic, and I think you did enough to kind of flag that there. The other thing you can also kind of throw into that category is spontaneous miscarriage, which, up to a third of all pregnancies can spontaneous miscarriage in that first trimester. I think you also did a good job of kind of quickly saying, hey, if you are pregnant and you're undecided, let's just set everything up so that baby's safe and you can make decisions down the line. And that was quite well done. We do have a message in from the chat from Kashminder about genetic carrier screening and CST. I would probably flag CST in this consult. I'd probably leave the genetic carrier screening and those kinds of things for subsequent consults personally. And a part of that would probably be just timing. I think that would be something you would probably do once you actually have established whether or not baby's going to be sticking around, if this is going to be a pregnancy to term, if that makes sense. But again, things to have on the radar. So I think while it was evident it wasn't the most comfortable case for you, I think you still ticked enough boxes there to have gotten through, and in particular your communication skills, I think would have made you a very much a pass on that case. So well done, mate.
Great.
Is good now to know this because pregnancies can come up for the CCE, and so I'd probably just refresh your memory, do a little bit of reading up over the next couple of days just on first trimester management. But again, if you got this on the day, you'd be fine. Well done.
Cheers.
In this case, the competent candidate demonstrates an understanding of pregnancy options and their respective processes, has an appropriate and sensitive prompt to tease out the history, in particular those social circumstances around this, and putting in a supportive management plan tailored to those specific patient needs. Communication, really important to be empathetic, non-judgmental, make this a safe place to let Sarah actually open up about the more sensitive aspects of that pregnancy, and as I think was done wonderfully here, in a neutral, non-directive manner, emphasising that patient autonomy and again using our evidence-based resources. So pregnancy is a little bit of a trap for a lot of GPs, especially if it is something where you have lots of other people in your practice that may kind of pick up that caseload. Things like pregnancy and mental health, very common for this. It's all fair game on the exam, and so it is something that if you know this is a weak area for you or an area where you want to be stronger on the day, I would encourage you to use these last few days to have a read through. And probably one final thing I would tack on to the end of this case here was it's a perfect opportunity, as was done here, STI screening, but also talk about contraception in the future as well. We've had one little accident here. How about we get a bit of a plan in place to make sure we don't have any accidents in the future?